Now, one of the things that just floored me this summer was the whole idea that preventive health care is cost prohibitive. And I thought, how did we get to that point in the discussion?
Yeah, I'm not sure, but I think that this now seems to be an area where we're starting to see convergence of thought and agreement that prevention is something. Congressman Fortenberry talks about prevention extensively. The House bill has a number of preventive measures. For example, in Medicare, one of the things that they're proposing to do is to eliminate the co-payments, the cost sharing for preventive services. Things like diabetes testing, some of the other colonoscopies, mammography. Those are things that would a Medicare beneficiary could be able to get without having to pay out of pocket for it. So there are a number of incentives like that in the House bill to encourage prevention. So I think we may be seeing that shift a little bit to more convergence about if we can keep people healthy and do some early testing. Finding something early, usually it's easier to address it than if you wait too long.
Good, good. Now, how can our viewers get involved with this issue? I mean, I think that we all want more information, information from reliable sources that are perhaps more nonpartisan in nature. How can people get involved?
Well, we do have a website at AARP called www.healthactionnow.org. That's our website on healthcare reform. We have just some basic information about some of the myths that we've talked about. And there are a lot of, we have, the internet provides us with a lot of resources in terms of just going to the sources, of looking at, reading the actual bill. It is a long bill, but it's in big type, so it is accessible. The Congressional Budget Office has a website where you can look at what they have done in terms of scoring bills and things like that. But just, again, to plug our website, Health Action Now, there also is a place where you can indicate that you'd like to send a note to your congressman in support of healthcare reform. There's an active map that shows how many people from each state have sent a note. We're behind Kansas right now, so I'm pushing that. Please go to the website. We want to catch up. There are ways that we can contact our, easy ways to contact our member of Congress, but also to get information from Library of Congress, Congressional Budget Office, the basic information about this bill.
Remind us again who our congressional delegation is.
Well, here in Lancaster County, Congressman Fortenberry is our representative in the House of Representatives. And our representatives in the United States Senate are Senator Mike Johans and Senator Ben Nelson.
Very good. Well, I want to go and encourage everyone that is viewing to inform themselves more and to also express your views to your representative in Washington. We are the Lancaster County Democrats. You've been watching the Watchful Citizens Show. We meet every third Tuesday of the month down at the Communication Workers of America Union Hall, which is at about 25th and N. We start at 7 p.m. and you can go and get to meet all sorts of involved people, and you can go and learn more about important topics that affect your lives and also be able to work for change that is positive for your family, your neighborhood, and for your community and state. I want to thank you, Mark, for coming today.
Sure, thank you. Appreciate
Do you have any closing remarks?
No, I just encourage people to get involved in this debate. It's a critical issue for our nation and every citizen within the nation. Let your congressman know how you feel and get up to date on what's going on in Congress regarding health care reform.
Thank you so much.
Thank you.